the challenges that our clients are facing are really very similar to the challenges that we ourselves are facing during the pandemic. And, the difference is the folks that we serve have barriers to access already. And this pandemic has really just exacerbated those barriers that already exist. One of the ways that that's been most prevalent was that at the beginning of the pandemic, we were all being told, stay home, self-quarantine. If you have symptoms, limit your contact with other people, especially if you're in an at-risk category. And the reality is that our folks did not have that option. The people who are staying outside couldn't go out and find a place to stay, even if they had a positive diagnosis at first. There were no options. It was either choosing between returning to a populated encampment or going somewhere to be by yourself, which wasn't necessarily the best idea if you're living outside and you're sick. So that was one challenge that was immediately concerning. Then, of course, meeting basic needs with meals and hygiene. There's limits to that already. There's folks have limited income, and areas of the city. Not all areas of the city have access to a place where you can go to get a meal every day. During this pandemic, a lot of the meal sites that did serve food before stopped serving food, and people that normally would go out there and help were following the order to stay home or following the order to have limited contact. So that wasn't available either. So we saw, luckily, the Beacon stepped forward to serve meals, but that's downtown, so that's difficult for people to get to if they're not downtown already. And they're serving over 500 meals a day, which was awesome, except for the fact that if you have health concerns and you're in one of these acute categories where you're higher risk, that's really not a safe option to go gather to get a meal. Metro stepped forward, which was also a really great resource, but if you're a part of this group, it still wasn't a safe option. Of course, also, just in terms of preventing the spread of germs, soap and water is not readily available if you're staying outside. A lot of the places people were going to use facilities weren't an option. And hand sanitizer was something that none of us could get. So it painted a pretty grim picture at first. So like, how are people going to meet their needs? But there's been a lot of really great community organizing that has responded to those concerns. In terms of a quarantine option, the community figured out a placement where people can get screened and tested and reside in until they recover if they get diagnosed with COVID-19. The community also pulled together resources to provide hand sanitizer and meal boxes that are available to people, like for outreach to distribute, and has been looking into, has been opening different meal sites that are available in the areas that get less attention or that aren't close to downtown. So we've been taking some time to identify those needs, but also figuring out how can we respond to them and make sure that people are getting the things that they need to encourage them to stay in place and not put themselves at risk.